Okay, we're gonna talk about conjunctival laceration. So the patient will come with pain, mild pain, red eye, foreign body sensation, and usually a history of ocular trauma. For the signs, fluorescein staining of the conjunctiva, and the conjunctiva may be torn and rolled up on itself. White sclera may be exposed and seen. Conj and subconj hemorrhage also can be there. For the workup, we do history and we go deep in the history. We try to determine the nature of the trauma and basically try to rule out a ruptured globe or intraocular foreign body. Evaluate the mechanism for possible foreign body involvement, including the size, shape, weight, and velocity of the object. Then we're gonna have to do a complete ocular exam. We check we put topical anesthesia and we check for scleral laceration or subconj foreign body. Basically, the entire area of the sclera under the conjunctival laceration must be inspected. Since the conjunctiva is mobile, we can inspect a wide area of the sclera under the laceration. We should use a proper cane soaked sterile cotton tipped applicator because we want to manipulate the conjunctiva carefully. Saline irrigation could be helpful to clear out scattered debris, and a cytal test may be helpful as well to rule out wound leak. And yeah, we basically do it by putting fluorescein, and we see the waterfall sign. Also, we could do a dilated fundus exam, especially the area under the conjunctiva, under the conjunctival injury where the laceration, using an indirect ophthalmoscope. Things also that you should consider is CT to exclude intraocular foreign body, as well as a B scan. That could also be helpful. Another thing that we can use is sometimes if it's severe and the ruptured globe is suspected, exploration in the OR under general anesthesia may be necessary, especially in children. Children, they don't give accurate history of trauma. So you should ask people who were there in the accident, observers who can tell you what happened exactly. And a detailed ophthalmic examination is necessary with children. So we talked about the symptoms, signs, workup. Now let's talk about the treatment. If it's a ruptured globe, then treat it as such. And I have another video, you can check it out. If it's not and you rule that out, that is the most important thing. You should treat it by giving antibiotics, antibiotic ointment like erythromycin or bacitracin polymyxin B, QID. You could also give a pressure patch, but it's rarely used. For the first 24 hours, you can use it for comfort. Most lacerations will heal without surgical repair, but some large laceration need to be sutured. So you should suture it. If it is more than or equal to 1 centimeter to 1.5 centimeter, then yeah, it's usually sutured with Vicryl, for example. But take care not to bury folds of conjunctiva or incorporate the tenon capsule into the wound, and also avoid suturing the plica semilunaris or caruncle to the conjunctiva. Now, for the follow-up, if there is no ocular damage, patients with large lacerations are re-examined within 1 week. Patients with small injuries are seen as needed and told to return immediately if there is worsening of symptoms. And that was conjunctival laceration. Thank you.